I am Dr. Praveen, consultant cardiac anaesthetist and intensivist working in Frontier Lifeline Hospitals. Cardiac surgeries per se themselves, they pose a lot of risk and they pose a lot of complications. An emergency cardiac surgery, they definitely carry 2 to 3 times more risks and complications. So we'll have to expect all these adverse events and complications as far as emergency cardiac surgery is concerned. Emergency cardiac surgery, whenever there is an emergency, as far as cardiac surgery is concerned, we have to quickly assess the patients because every minute that we lose, we are definitely going to lose more of the function of the heart and of all the other systems. There will not be a lot of time as far as assessment is concerned, but we have to do it as rapidly as possible. So there is no particular time frame, like for example, we have 2 hours or 3 hours or 1 hour or 30 minutes. As quickly you assess and as quickly you take them to the operation theatre for the remedy. There are many priorities actually. As far as the anesthesia team is concerned, there are a few priorities as far as emergency cardiac surgery is concerned. One important priority, as probably all of us would expect, is the availability of blood and blood products. In case if the patient belongs to a rare blood group, arranging those blood products will be definitely difficult because, as you all know, blood is something that you cannot buy for any particular price. People have to come, they have to donate, and you have to get that available blood at the right point of time. And one important part of anesthesia is patients have to be fasting for a period of time, and many times they might have just had something, they might have consumed something. That has to be taken into account, and that has to be taken as a risk as well. And as I told in the previous question, you have to quickly assess. Can't take a lot of time. You have to quickly assess and take the patient to the operating table. There are a few priorities for the anesthesia team as far as emergency cardiac surgery is concerned. One very important priority is the availability of blood and blood products. Arranging blood and blood products, especially if the blood group is a rare blood group, becomes even more tricky. And the other thing is the patients would have always had, we call it in medical terms as full stomach, like they might have consumed something, they might have had food, they might have had juices, or they might have had some milk, and all these things contribute to the more complexity of the situation. And we have to quickly assess the patient. We cannot take a lot of time, we cannot wait on a lot of investigations. The definite investigations have to be in place, but apart from that, we cannot wait for the second rung of investigations. We'll have to quickly take the patient to the operating table and we have to go ahead with the surgery. Stabilizations of unstable patients is not very easy without putting them to the operation theatre. For example, the remedy is either in revascularization or in the surgical process. So you cannot really stabilize them completely in a CCU or in a room side. So you will have to take them to the operation theatre for further stabilization. Some amount of stabilization can be done with drugs as well as mechanical support. These are the common ways by which we can stabilize the patient.